welcome to Health Impact Live's Digital Health Talks. This is Megan Antonelli, and today we are talking about healthcare AI administrative automation. And my guest today is Dr. Yan Chow, Global Healthcare Leader at Automation Anywhere. He's been a guest on the show before, and he is a good friend to Health Impact. Hi, Dr. Chow, how are you?
Hi, Megan. It's great to be here again.
Yes, it is so great to have you. And, it's amazing to think, I think we really met over, around the pandemic when we started
Yeah,
partnering
yeah,
and it's been a long 5 years in terms of the
yeah,
progress and the how this pace at which the adoption of automation has happened. So tell us a little bit. I've always, your career and your background and the work
sure,
you've done. Give us a little bit of your background and then, the work that you do at Automation Anywhere.
sure. I'm a pediatrician. I spent most of my career at Kaiser Permanente for about 32 years. The last 8 years, I was the National Director of Innovation and Advanced Technology. And from that, leaving Kaiser in 2014, I went into federal IT for a federal contractor as a Chief Innovation Officer for a year or so. And then came back to work for Amgen, a biotech, uh, as the digital medicine lead. And then six years ago, I joined Automation Anywhere, a technology firm in San Jose, to be there to help launch their healthcare vertical. So it's been, you think about 6 years ago, it was a very interesting time, right before COVID, right before Gen AI, right before all the transparency regulations from federal government. So it's been a wild ride, but I really enjoyed it, thoroughly enjoyed it. And
Yeah.
it's always great to see you each year and to find
Yes.
out from other people what's going on. But I think healthcare has been a very interesting journey and will continue to be, I think, the next 5 or 10 years.
Yeah. It's really been so interesting. And I really think, obviously in our lives and in the world, the pandemic is such a bookend, but in healthcare, it was such a transformational moment. And
Yeah,
then
yeah.
that coupled with the, access to
Hmm.
large language models that, really just kind of accelerated everything. And we're seeing that, happen and the adoption happen
Hmm.
again. And yet in healthcare, it still takes time. There's still, there's fits and starts and there's appetites for adoption and then there's real adoption. And I think one of the things about where you sit is you really have a very close eye on what is and what is not being adopted. And I think we've talked a bit about sort of the revenue cycle and some of the
Hmm.
processes that have been tangible and easy wins for healthcare. But I'd love to hear you talk a little bit about kind of what you're hearing from the hospital and the health system CFOs
Hmm.
and CIOs about like the outcomes and the metrics that they are looking for or even what they should be looking for in terms of
Hmm.
impact and kind of timelines for real value in this.
Hmm. Yeah, I think we had discussed before we started, we had discussed clinical AI versus administrative AI. And of course, administrators at hospitals tend to look at the administrative AI. And you think about it, clinical AI is actually more interesting and it saves lives, but administrative AI saves the healthcare system. So I think right now, what we're seeing in the market is that most people are focusing on the administrative AI for now, because that's what they're familiar with in terms of automation. I would love for AI to do clinical things, but the reality is that US healthcare isn't broken because we lack diagnostic capability. It's collapsing under its operational complexity. So I focus on the administrative side because that's where the need is, where the demand is, and what you might call the cognitive tax is highest. We currently are asking clinicians to be data entry clerks. So when we deploy AI agents to handle prior auth and claims processing or referral management, we aren't just saving money, we're actually buying back mental bandwidth. And so you think about it, automation and AI still is pretty much focused on creating the entire digital body. So the AI is the digital brain that helps us, but the automation piece is what gets things done. And I think that's the interesting thing. So if you're talking about success metrics today, and we're talking to CFOs and CIOs, one piece of advice I would give is stop looking at cost reduction and start looking at cash velocity. If a CIO, CFO only looks at headcount reduction, they're missing the bigger picture. The metric that matters now more than ever is cash velocity. How fast can we turn a patient encounter into realized revenue? And with the shift to AI agents that handle unstructured data, like our document automation module, and these are things like messy EOBs or complex denial letters, we are seeing organizations move from managing denials to preventing denials. And so, what are the right sort of metrics of success? One is that you should look at the touchless processing rate. If you are automating, but humans still have to review 40% of claims, you haven't really automated, you've just digitized the queue. And so what percentage successfully go through without the need for human review is a metric that is worth looking at. And the second thing is the timeline. With modern Gen AI driven automation, the time to value has reduced drastically. Instead of waiting 12 months for an ROI, you should see stabilization and some ROI within 12 to 16 weeks. If it takes longer, then probably the scope you have is wrong. And that's what I would say.
Wow. Yeah. I mean, I think that you said so much in that. I mean, I think the piece around kind of saving the hospitals, right? And I think and saving the system is so important, because without that, we can't deliver the care that we want to and that we need to. And we're seeing hospitals struggle across the country, both in rural and urban settings, for sure. And I think that piece of it is so critical. And then around that sort of value and identifying value and sort of velocity of revenue, I think is so important. And when we think about, as you said, the sort of sexy, fun, interesting areas of automating clinical care, it's important. But the point you make about what's broken is not our diagnostics. Right. It's not our, research. We're at the top of the game there. It's the system that is, slow and burdened by so much. Right. And this back office automation can help with that, quickly. So where do you see, either now or, looking at the past year or what's to come, kind of those pockets of, innovation around back office automation that are really promising in terms of particularly that, velocity of revenue and cash flow?
Well, I think traditionally we've seen a lot of automation, in terms of back office and revenue cycle, and we still see the bulk of demand is in revenue cycle. All the sub processes that are associated with it, such as patient appointments, patient essentially validation, coverage validation, the visit, the billing and coding, the reimbursement, and so on. That process is pretty well worked out, even though it kind of varies from organization to organization. But what's interesting about sort of the back office automation is this moving to the front office. And the front office is sort of the beginning of the process where the patient first touches the system. It is also part of revenue cycle, but it's never been a back office function before. So if you think about it, the traditional back office automation is asynchronous. We can do it at night, we can batch it, but point of care automation has to be synchronous and invisible. So when you're actually dealing with a patient, that is a critical distinction. So back office automation is working at night. Front office automation is working in real time. So when a doctor is sitting with a patient, they can't wait for a bot to run a script that's based on information, even information that's available a few days ago. They need an AI agent next to them or embedded directly in their EHR like Epic, Oracle, or Meditech that anticipates their needs in real time using current information, current lab tests, current patient history and context. So for instance, if you're a doctor and you order an MRI, the agent would instantly check the insurance, spot a missing prerequisite, prompt the doctor right then, and prevent a denial 3 weeks later. That's really important. So back office automation fixes problems after they happen. Point of care automation prevents them from entering the system in the first place. And in a sense, I think that's where the market is going. So you're still addressing revenue cycle, but you're being a little bit more proactive. Right now, probably the thing that's getting the most attention is auto-scribing or ambient clinical intelligence, where you have a microphone in the patient exam room and then the AI can produce a structured note and recommendations afterwards, for the doctor to review. And so we're getting back to the old days where the doctor pays full attention to the patient without having to consult their PC or do data entry.
Mhm.
Now, imagine if in this experience, the AI were interactive in real time with the doctor and the patient. The AI would be both a student, kind of a student intern who can learn from the experience, but also an expert attending who gives advice for the doctor and for the patient. I think you think about the role of AI, I think that's really a very interesting role. And it's just a sort of analogy for the role it may take in many different areas of healthcare, and sort of being an assistant and a learner. So,
Right. Yeah. And I mean, I think that idea of sort of that automation at the point of care,
mhm,
but, where sometimes that might go to completely clinical, what you're
mhm,
talking about is automation at the point of care that allows for that visibility of, coverage,
mhm,
coverage,
right,
capabilities and what a patient does have access to and what will be a less expensive treatment and a higher value treatment for, depending on programs. And I think that that's one of the things that a lot of people, don't think about. But in essence, that's where so much of the friction comes from in a patient
right,
experience, right?
mhm,
People don't leave healthcare and say, God, my physician was terrible. Well, maybe sometimes they
right,
do, but generally it's,
right,
I didn't get coverage, or I'm not sure they're
right,
giving me what I want, what I should have based on what I can
mhm,
afford.
mhm, mhm,
It's this lack of kind of trust. So
mhm,
that idea that AI could provide that visibility and then
mhm,
enable that conversation, which often
mhm,
happens much later,
right,
with an administrative person as opposed to with your clinician,
right.
when it should happen with your clinician, right?
And another example of that is sort of a new technology called conversational AI. And this is something that, it's not just interacting with the patient and doctor. It's actually the interface is the natural language interface that allows a patient and doctor to talk in natural language and not have to understand how do you do this so that the machine understands what I'm trying to say. You don't have to do that anymore. So when people think about conversational AI, they think, chatbots. But I'm going to coin a new term. What I call the new chatbot is the do bot. So the do bot era is here with emphasis on the word do. And so we have all seen conversational AIs that can answer questions like, where do I park? Or what are your hours? But this is low value. The separation between hype and value is agency. So a future is not a chatbot that tells a patient how to schedule an appointment. It's an AI agent that actually converses with the patient to find a time, logs into the EHR, books the slot, and triggers the paperwork. And if your AI cannot execute transactions across all the systems that you need to, then it's just a fancy FAQ page. And the winners will be the systems that connect language models to automation layers to actually do the work. And as much
Mm.
as possible, take these tasks off the plate for clinicians and office workers and patients. So
Right.
yeah,
Well, and
and
that,
we're getting there. We're getting there actually.
yeah, no, I mean, and that's it, to go from sort of this AI agent conversation to patient agency, which I
Yeah.
think a lot of the discussion
Mhm.
around patient experience is
Yeah.
is shifting to patient agency, right? So
Mhm.
that's what patients really want. No one expects to go to the hospital and have fun, but they want to be in control, right? They want to be in control. They want to
Yeah.
feel that
Yeah.
they are making the choices and that they are in the driver's
Right.
seat. And a lot of the time, it's the lack of information and access to
Yeah.
information, both on the provider side and the patient
Mhm.
side, that is in the way of that agency for both of them. And um, and even when you think about the physician, that is also
Yeah.
their
Yeah.
satisfaction criteria, is their
Yeah.
agency in all of
Right.
this, right? If they
Right.
feel that they're no longer able to make the best decisions for their
Mhm.
patients because
Mhm.
of, sort of black box information into what is or is not covered or things like that,
Yeah. Yeah.
so it goes both ways. And I think with
Yeah.
what you're talking about in terms of that conversational AI, because it's pulling that information and then able to have that
Mhm.
discussion with them,
Mhm. In
is
fact, you
huge.
could theoretically even ask about conversational AI, why did you say this? And that is actually a very interesting question because it gets to the root issue of explainability. Now, you're not in control if you can't explain. You can't figure out why something happened or why you had to do this or that. So I think there's a lot of potential as people start designing the systems to really have a two-way system that lets you have a lot more visibility and maybe a lot more control into what's
Right.
going on.
Yeah.
Yeah.
Well, from your perspective, I mean, there's
Hmm.
so much, and we've talked about this a little bit in terms of the art of what's possible and the art of the possible in
Hmm.
healthcare and AI and automation. And I think, we always get distracted by the shiny objects and what's new and what's hot.
Right.
But when you sit in such a unique place in terms of seeing what people are looking at, and then a little bit of what they're not looking at, like sometimes
Yeah.
they're missing. When you think about that, I think when I thought of the question, I was putting an 18 to 24 month time frame, and that seems too long given the pace
Yeah.
at which things are kind
Oh,
of
yeah.
appearing. But what's your, when you think of what's coming and what's most exciting, where do you think people should be focused?
Well, it's interesting. I would say there are four areas, and we had talked about this a little bit before. Four areas I would bet on. So for the CMO, the CMIO, I would say automated clinical decision support at scale, right? Not just alerts, but AI that actively, sort of proactively surfaces relevant information during a workflow. Imagine a system that pulls relevant labs and imaging and notes uh, into a summary when the patient just opens the patient chart. That would be fantastic. The technology exists, but the challenge is integration and personalization. So health systems that build this capacity will have a significant competitive advantage, not just in quality of care, but in recruitment and retention. Because again, for a physician who hears that some system somewhere has a system where the moment you see a new patient, it'll give you the entire summary so that you don't walk in ignorant, essentially missing anything. The second area is for the CMO and CMIO also is autonomous care orchestration. So I can see a future where we're going to add AI. Everybody is adding AI to their software. So you're going to have a lot of AIs running around. And the issue is, how do you know what each one is doing? And this is particularly important because healthcare is a regulated industry. So you can actually build AI agents to act as as for automated compliance and audit readiness. So you can actually have agents prepare audits, can monitor in real time what's going on with all the other AIs that are running around. And for that, you need actually a governance layer, as sort of an orchestration layer. And of course, we provide that, but it's going to be even more important because when the regulator says, what is this software doing? You have to be able to explain it, and you have to explain why. And that's going to be very, very difficult without a governance layer. And also in terms of security risk and things like that, healthcare systems as I mentioned, spend millions of dollars on compliance. And so that's worth doing. The other area for the CMO and CMIO is um, AI agents can act as patient concierges. So imagine an agent that is activated when a referral is generated and then proactively contacts the patient, finds an opening in the doctor's schedule, handles the auth, and reminds the patient to show up. So this is a win-win because it improves clinical adherence and improves patient outcomes. And then finally, I mentioned for the COO and CFO, intelligent supply chain and inventory management. This is something, it's it's amazing. A lot of systems it's still manual. It's still manual and like on Excel spreadsheets. So AI that can predict case volume, optimizes par levels, automates reordering, identifies cost-saving substitutions. You can actually reduce. Some people have said you can reduce supply chain costs by 15%. That's right off the top. So that's pretty important, and it's important to also note that these areas, many of these areas are not sexy. No, they're not, they don't make news, but they do address pain points that senior executives deal with every day. And that organizations, I think, that invest in these areas will have uh, months of operational advantage over competitors. So I would recommend in these areas, such as autonomous care orchestration, clinical decision support, intelligent inventory management, supply chain, uh, automated compliance, and so on. that you would invest about 10 to 15% of your automation budget to explore these areas or partner with vendors willing to do proofs of concept with shared risk. Um, it's interesting, a lot of people think that things would be perfect before you go forward. They don't have to be because there is a learning curve. And so you don't want to be caught behind. You don't want to start when everybody is doing well because at that point you're behind. So and that learning curve is different for every organization. It's
Yeah.
different resources, different strengths and weaknesses, and so on.
Right. Well, that's a lot. That's a lot of possible, right? And
Yeah,
and,
yeah.
it's and sexy or not, a lot of it is real
Hmm.
areas where the success and failure rate is important, right? If you
Right,
don't do those
right.
things well, you're either losing money or losing patients,
Hmm.
significantly. So, but I think one of the things that we hear in terms of, you do these programs, that there's
Hmm.
the implementations tend to, can stumble a little bit when, various things happen. There's a lot of, whether you mentioned governance and sort of the change management and, any cultural change and or workflow changes are
Yeah,
hard. What
yeah.
are some of the, like, if you think of kind of common failure
Right,
points that you're seeing,
right.
what are
The,
some of
I,
those?
yeah, I think the three most common points of failure are data and technical challenges, because it's a new thing for a lot of organizations, and many of them don't have the expertise. So these will also change with technology changing, right? So the points of failure, the data technical challenges will also change. The second thing is a lack of um, clinical integration and user trust, and that's part of change management, which I'm quite familiar with. And finally, as you mentioned, the ethical and regulatory hurdles, the governance, the compliance. So, from a process perspective, um, a common issue arises from what some are calling paving the cow path. I like that phrase. It's taking a broken manual process and automating it exactly as it is. And we see that frequently. What that gives you is a bad process running at the speed of light, and it gives automation a bad name. So successful organizations, we've seen do two things differently. First is they do process reengineering. So they ask, with AI-based automation, do we even need these multiple steps? Well, they may take a step back and re-envision the entire process end to end, focusing on priorities, goals, and results and outcomes, rather than accommodating human limitations. And this is something that's really pivotal. And a lot of organizations, I understand, I mean, I understand why they don't have the resources to do this, but long-term wise, it's probably the best thing to do. And then the second thing is democratize governance. And so far-thinking organizations, those that are very advanced, don't sort of lock automation in an IT ivory tower. They set up guardrails, but not gates. So they allow business units to build their own automations within safety parameters. And the reason is, and I found this true to be at Kaiser where I worked, is if you wait for central IT to build everything, you will never scale fast enough to beat the labor shortage. And guess what? Your staff are already using AI and automation. I bet every organization is doing that. And so you just don't know it. So you're not managing it. And I think that's sort of the key. So it has, you mentioned AI is a change, and AI is a fundamental change. It changes the way we do everything. And it requires the work to really understand how to go forward. And I think a lot of people have their heads down and they're just too busy to do that, which
Well,
is an issue.
it
Yeah.
is, that change and the change management that's required,
Mhm.
but it itself is changing so quickly, right? And I
Yeah.
think
Yeah.
we hear a lot of comparisons. I mean, the paving the cow path being, sort of the direct correlation between, sort of AI, EHR implementation and adoption, right? I mean, that was the last kind of
Right.
big, huge technological platform change within healthcare. And
Mhm.
so we're often creating the comparison between the two.
Right.
But what are your thoughts on, like, are they similar? Are they fundamentally different?
Actually, they're fundamentally different, I think.
Mm-hmm.
AI is actually, I would call it the anti-EHR. So I think that helps to think of it like that. I think the EHR adoption curve was driven by federal mandates, like meaningful use. It was forced on clinicians, often without their input. And honestly, it made their lives a lot harder. So it turned doctors into into frustrated typists. And and I certainly heard a lot about that. And I felt that too myself when we came up with the EHR. On the other hand, AI adoption is driven by desperation and relief. So AI is the anti EHR. Its entire purpose is to remove the friction that the EHR introduced. And it is the first technology in 20 years that promises to take work off the clinician's plate rather than adding to it. And because of that, adoption won't be just faster, it'll be bottom up, driven by staff demanding those tools to survive their shifts. It's yeah, just an anecdote. When Gen AI came out, when ChatGPT came out, and I was at HIMSS that year, you could not walk 20 feet without hearing somebody talk about ChatGPT. Clinicians and administrators are so excited. So my prediction is that AI adoption will be faster than EHR adoption, but less uniform, primarily because the scope of AI is so much more expansive. So leading health systems will deploy it aggressively across multiple domains and see significant competitive advantage. Mainstream organizations will follow selectively, and I think laggards will find themselves at a serious disadvantage within 5 to 7 years. The key difference is that AI doesn't require replacing core infrastructure because it layers on top. And this lowers barriers to adoption, but also means that organizations can cherry pick applications rather than committing to wholesale transformation. And whether that's good or bad sort of depends on your organizational philosophy, I guess.
Yeah, no, absolutely. And I think your point around the difference and the distinction, but also that the desire to use it to help, they're like you said, people are they're going to use it no matter what. So if you don't, if you want to have it, if the governance, then you've got to take sort of the reins of what it is that you'll be, using there. But I also, it's almost like, an EHR is a very specific tool, and that this can happen anywhere. And in healthcare, people they're always looking for that rule book, that playbook of how do we do this? How do we do this in a sort of systematized way? What do we start with and what do we end with? And how do we layer 17 layers of governance over it to make sure it happens in a slow and methodical way? But this is much more amorphous, and it comes at every, it's coming from every direction. So it does change that, and it makes it, certainly exciting to watch and be a part of.
It changes the way that people do work, which is, it's a fundamental change. And so, I mean, I don't know about you, but I'm using AI every day, to be more productive, and actually to do things I could not do before. I can't spend 24 hours searching the web, for information. AI can do it in a minute, less than a minute. So that kind of productivity multiplication is huge. And it changes the way we think about how we do work. And do we really want to do the work ourselves, or do we want to be able to run several agents to do it for us? It's kind of like a management thing, right? Would you rather manage, or would you rather do it yourself? And,
right. The orchestration piece is huge. And then, it's sort of orchestration and agency a little bit, because there's a part of the search and research and, sort of finding that you do enjoy, but then is it the synthesis and the outcome that is the sort of thing that gives you that passion and that joy of what you're creating? I mean, I literally had a conversation with my husband this morning. He's like, you can't even tell the difference between what's AI and what's not. And he works in technology and prides himself on all of that. And it's like, and I said, well, then does it matter? I don't know, and it's a sort of theoretical thing. Like, if it's as good as you want it to be, then it's good enough.
It's interesting. A while back, I wrote an article called "The Hidden Ripples of AI" and the secondary consequences of using AI throughout healthcare. One is that busy physicians will tend to check the box. If they know that AI is correct 99% of the time, they'll check the box without thinking. And so how do you address that? Because you don't necessarily want AI to always be approved, because what happens is that goes into the learning database, and the AI will learn that's a correct decision in this case. So it'll become more and more towards the medium, right? Towards the average. And so one of the ideas is to just always present a differential diagnosis of three things. So the physician has to consciously think, oh, I didn't think about this one. Maybe it could be this, right? And so And there's a lot of stuff that's not in AI that we think is in AI, such as for physicians. We actually, when we meet a patient, we sense their posture, their emotion, how they shake hands, how they talk. And that doesn't actually get into AI at this point. Maybe in the future it will, because that's part of what physicians call their gut feel. So,
Right.
you have this intuition, and it's based on years of experience with
Mhm.
all these senses and all these sort of outcomes that, you know, so it's hard to replace that at this point, but maybe eventually it will. And then,
Right.
so we'll see.
Yeah. At the American Heart Association meeting in November, on the stage, they did a um, beat the AI with the physician. So they had three physicians, and they had various AI models take questions. Some of the questions were cases that would have been on, say, the medical exams, but then there were
Right,
some really hard cases.
right.
And ChatGPT won. But I think what was interesting, one, they didn't have ChatGPT and doctors, right?
Mm,
Or, and there
right,
were multiple
right.
large language models. I shouldn't favor ChatGPT so much, but they were using all the different many different models, plus the physicians alone. And it's the physicians with the AI
Mm,
that we want. That's the one that we at least hope to win, hope wins, right? But then the other side of that was, when the AI got it wrong, it got it really wrong.
yeah,
Whereas when the
yeah,
physicians got it wrong, it got it wrong confidently. Whereas the
right,
physicians got it wrong, and they were generally asking for another test. Right. They were
right,
saying, well, I'm
right,
going to need another MRI.
right,
So while
right.
the insurance companies might prefer this, ChatGPT. It was such an amazing thing to watch. And these are like the top cardiologists in the world,
Yeah, yeah,
up there. And more
yeah.
power to them for actually taking the assignment and doing it with a really good attitude too. But it'll be so amazing to see how that
Mm.
ends up working. But it for sure will need to be more careful around those decisions than maybe
Yeah,
we are with some of the more as we said, less sexy automation tasks and
yeah,
tools that make a big difference.
yeah. And it's an ongoing discussion about whether humans plus AI or AI alone is better. And the latest articles say that it probably depends on the context, that situation. But one of the things that is a little bit scary is that if AI is so good at consolidating medical knowledge and so on, how can physicians fight back, if they have a gut feel that is different than what the AI says? I think that's one of the issues that's going to happen is the insurance company may say, why didn't you pick the AI recommended route, and now the outcome is bad? And the physician will say, well, before they didn't have to defend, right? They'll just say that was my decision based on my experience. Now they'll have to defend. Well, your AI had 300,000 cases to look at. I looked at 3,000 in my lifetime, So I think it's really some of these issues are, and then the other issue is kind of interesting in terms of the AI being expert is that if you think about it, if the AI can solve issues like sore throats, urinary infections without your help, then what is the physician left with? The physician's whole schedule is going to be cases that cannot be solved by AI, right? So that's a very daunting kind of schedule.
They're going to be
And
wishing they had their EHR and their pajama
yeah,
time back.
they have no break, right? They have no break.
Right.
Every patient is tough.
Everything is a complex case,
and
right?
and so you'll have cognitive burnout. You have a different kind of burnout. And
Right.
so I think a lot of these issues need to be discussed and need to be solved. Otherwise, humans, uh, there's a human component when you redesign systems, and that implies you've thought about what is the value of a doctor, of a nurse. What's the value of this and that, and where can we use those people the best? And I think, I don't think people are talking about laying people off, but I think it's just a matter of, given all these new technologies, what's the best way that still meets their their needs for professional satisfaction and a survivable career. So
Yeah.
yeah,
No, absolutely. There's so much there, and I think, and that's where I worry is making sure that we continue to have the ability for that deep thought,
mm-hmm.
because these are complicated sort of decisions that we can't outsource to the algorithm, that we have to put, value-based decisions on in how we design these tools to help and what we want to keep for ourselves versus automate away. So it's so interesting. Well, a great place to talk about that will be health impact in February.
Yes, looking forward to it.
You know how in our last few minutes, we always like to talk about what's good. And we've talked about lots of things that are good. But if you just had to pick one thing, what are you most kind of optimistic about right now as we look into AI and automation and in health?
Well, I think, that's actually, the picture looks good, actually. It's becoming good. And first is that AI is definitely having an impact on clinician burnout. I think people are very happy with Gen AI and stuff. I think second, it's clear that the economics are undeniable. There's a lot of benefit, clear ROI to automation and AI. And then the third thing, which is even more intangible, is that the technology is advancing faster than expected. And I think that's why it's hard to predict, hard to plan for the future. What basically is the problem, though, is implementation. So healthcare, we just don't have expertise very much in deploying automation and AI. It's a new thing, right? So as a result, we at Automation Anywhere, we actually are developing new programs for advisory and consulting services because we're finding that people are asking, and we're one of the resources maybe for knowledge, but there's very little knowledge out there, even among big organizations. So ultimately, I think my optimism isn't about technology; it's about necessity, and that actually is a very heavy driver. So, but the reward is worth it. I think we're working towards the future where clinicians get their time back, organizations can thrive without downsizing, and patients get the access they need. And that starts today. We have to take the first steps today.
Oh, that's great.
If the audience is watching this podcast, we would of course love to chat with you and get the process started. So you have to do that.
Well, yeah. And I was just going to say, I always learn so much when I have a chat with you, either on our platform here or in person. And so the fact that you guys are going into sort of that consulting and advisory services is amazing, because I think you guys just have a wealth of experience that, it's hard to get, sort of that real world view of how to implement these in practice. So that's great. And I do welcome and encourage our audience to both tune in and come to Health Impact, but to reach out to Dr. Chow, because he is a fantastic resource in this space. So thanks so much for joining us. And I look forward to seeing you soon. And to our listeners, please visit automationanywhere.com to learn more about their work, and always reach out. And thanks for more conversations with healthcare leaders. Tune in, subscribe to Digital Health Talks, and visit us at Health Impact Live. This is Megan Antonelli signing off.